Hello, I am Dr. Avinash Chaitanya, Head and Neck Surgical Oncologist. Today I am going to tell you about a tool which helps us to diagnose and treat oral cancer early. As we know, by diagnosing oral cancer at an earlier stage and giving them the correct treatment, we are able to save more patients. That is, survival is better, and also we are able to decrease the treatment that we give them. Sometimes in early stage of oral cancer, doing a surgery alone is sufficient, and we did not give the more toxic forms of treatment like radiation and chemotherapy, which are required for stage 3 and stage 4. This tool is nothing but oral cancer screening. We know that oral cancer upstarts as a small ulcer in the mouth. It can occur anywhere from the lip to the back of the tongue. And if we are able to identify that ulcer at an early stage and go for the diagnosis and treatment, we are able to catch them at a much earlier stage. For oral cancer screening, we require nothing more than a torchlight or a good natural light and gloves. We should be able to see the ulcer, we should be able to palpate around it, and then we will be able to know whether it is a benign ulcer or a pre-malignant lesion or actually a cancer. For that reason, getting screened by a professional is more important, but you yourself can do self-examination and see if there is a persistent ulcer in your mouth, and you can come to the physicians or to the ENT surgeons or to the dental surgeons or to an oncologist and get it diagnosed and treated. With the help of oral cancer screening, we are able to generate a lot of patients who are going to be diagnosed at an earlier stage in stage 1 and stage 2 rather than the more common stage 3 and stage 4 in which the patients are diagnosed in India. Oral cancer screening requires you to check at 8 specific sites in the mouth, which includes the lips, the upper gums, lower gums, cheeks on both sides, tongue at the starting, at the edge, and at the back. The floor of mouth is also included in the oral cancer screening. The only requirement is good mouth opening and good adequate light. It is very much cost effective and does not require any major scans or any major diagnostic invasive tests. In this way, oral cancer screening is a very effective tool to diagnose and treat early, and any patient or any person who has any symptoms or is in the high risk group should go for oral cancer screening once every 3-4 months at least, and then if there is a treatment that is required, he can go ahead for it. Thank you.